Obesity and excess visceral fat are an important and major complication in people living with HIV, but luckily new treatments exist. There's emerging data about the benefits of GLP-1 receptor agonists in people living with HIV that specifically can support their efficacy in this special population with excess cardiovascular, kidney, and metabolic risks. The GLP-1 receptor agonists can reduce weight, improve glycemic control, and treat steatotic liver disease, even at moderate doses, though gastrointestinal side effects are important to monitor, and it's also important to be aware of several less common but potentially important adverse events that may also require monitoring and referral. Finally, tesamorelin and other obesity management medicines are possible treatment alternatives in this population. However, they're most useful in those who may not be candidates for GLP-1 receptor agonists or for whom those drugs may not be within reach.